Have you noticed your pet walking just a little differently lately? Not dramatically, not limping badly, just different. Maybe they walk slower than they used to. Maybe they hesitate before climbing stairs. Maybe they put more weight on one side. Or maybe their walk just doesn't look as smooth or confident anymore. Most pet owners brush this off. They say, "He's just getting older. She's probably tired today. It's nothing serious." But here's what many people don't realize. A small change in walking is one of the earliest warning signs of serious joint or nerve problems. And missing this sign can cost your pet years of comfort. Today, I want to help you understand what that change really means, what causes it, what science tells us, and what you can safely do at home to help your pet feel better.
By the end of this video, you'll know why pets change the way they walk, the difference between joint pain and nerve damage, which walking changes are serious and which are not, simple vet-approved home remedies, when home care is enough, and when it's time to see a veterinarian immediately. This information is especially important if your pet is over 7 years old. Why walking changes matter. Walking is not just movement. Walking is the result of healthy joints, strong muscles, proper nerve signals, and a pain-free body. When something goes wrong inside the body, walking is often the first thing that changes. Pets are incredibly good at hiding pain. In the wild, showing weakness meant danger. That instinct never left them. So instead of crying or complaining, they quietly adjust how they move. And that adjustment is the warning.
Let's start with the most common reason: joint disease. According to American veterinary research, more than 20% of adult dogs and cats suffer from arthritis, and that number jumps sharply in senior pets. What happens inside the joint? A healthy joint has smooth cartilage and lubricating fluid. This allows bones to glide effortlessly. As pets age, or due to injury, genetics, or weight, that cartilage wears down. When that happens, inflammation develops, fluid decreases, bones start rubbing, and pain increases with movement. Your pet feels this pain every time they walk, so they adapt. They take shorter steps, they walk slower, they avoid pressure on the painful joint. This is not laziness, this is pain avoidance.
You might notice stiffness after sleeping, difficulty standing up, reluctance to jump, slow or cautious walking, favoring one leg. These signs often appear months or even years before severe arthritis is diagnosed. Early detection matters. Reason number 2: nerve issues, often misunderstood. Now let's talk about nerve problems. Nerve issues are more subtle and often more serious. Nerves control muscle strength, coordination, balance, reflexes. When nerves are damaged or compressed, muscles don't receive proper signals. This can happen due to spinal degeneration, disc disease, inflammation, or age-related nerve decline. What does this look like? Wobbly walking, dragging paws, weak back legs, crossing legs while walking, loss of coordination. Many owners think this is just old age. It's not. It's a neurological warning. Reason number 3: age, breed, and genetics. Some pets are simply more vulnerable. Large dog breeds, long-backed dogs, certain cat breeds. These pets often develop joint and nerve issues earlier in life. Genetics influence joint shape, cartilage durability, spine structure. This means walking changes may appear even before obvious pain. That's why observation is so important.
Warm compress therapy. Heat increases blood flow. Here's how to do it safely. Use a warm towel, never hot. Apply to stiff joints. 5 to 7 minutes, once or twice daily. Benefits: relaxes muscles, reduces stiffness, improves comfort. Many veterinarians recommend this as a first step. Helpful additions: omega-3 fatty acids, a vet-approved dosage, unsalted bone broth, soft, joint-friendly foods. Avoid excessive treats, high carbohydrate processed foods. Nutrition directly affects joint and nerve health. Do short walks, flat surfaces, slow pace. Avoid long walks, stairs, jumping, slippery floors. How to do it: use your palm, slow circular motions, around joints, not directly on bone, 3 to 5 minutes. If your pet relaxes, you're doing it right. Provide a soft, supportive bed. Avoid cold floors. Keep sleeping areas warm. Cold worsens joint stiffness. Comfort speeds recovery. Hibiscus oil and collagen for dog and cat arthritis and joint stiffness. Important: first, please read. Hibiscus oil equals external use only, dogs and cats. Collagen equals oral supplement. Severe pain, paralysis, young sudden limping equals vet visit required. Hibiscus oil. Why hibiscus oil helps scientifically. Hibiscus contains natural anti-inflammatory compounds, antioxidants, mild muscle relaxing properties. Veterinary herbal studies show topical anti-inflammatory oils can improve blood circulation, reduce stiffness, ease muscle tension around joints. How to use hibiscus oil, dogs and cats. Safe method, step by step. Take pure hibiscus oil, no fragrance, no essential oil blends. Put 2 to 3 drops on your palm. Rub palms together, slightly warm. Massage around the joint, not directly on bone. Gentle circular motion, 3 to 5 minutes only. Best joints: knees, hips, elbows, shoulders, in dogs. Once daily, evening best. Severe stiffness, max twice daily. In cats, once every other day. Cats are more sensitive. Do not use if open wounds, skin infection, cat licking the area excessively, essential oil mixed hibiscus. Cats are very sensitive to oils. Always use minimal amount.
Collagen. Why collagen works. Collagen is main building block of cartilage, supports joint cushioning, improves flexibility over time. U.S. veterinary nutrition studies show slows joint degeneration, best when used long-term. Which collagen is safe? Hydrolyzed collagen peptides, unflavored, no sweeteners, no xylitol, very dangerous for dogs. Collagen dosage for dogs. Small dogs up to 10 pounds, 250 milligrams per day. Medium dogs, 10 to 40 pounds, 500 milligrams per day. Large dogs, 40 to 80 pounds, 750 to 1,000 milligrams per day. Giant dogs, 80 plus pounds, 1,000 to 1,500 milligrams per day. Mix with wet food, bone broth, soft meal. Collagen dosage for cats. Cats need much less, 100 to 250 milligrams per day only. Best method, mix powder with wet food. Start with half dose for 7 days.
How long to see results? 7 to 10 days, stiffness slightly better. 3 to 4 weeks, noticeable mobility improvement. 8 to 12 weeks, best joint support results. Collagen works slow but steady. When not to use collagen. Kidney disease, ask vet. Digestive sensitivity, start very low. Protein allergy. Best combination strategy, that style. Morning, collagen with food. Evening, hibiscus oil massage. Daily gentle walk. Warm sleeping area. This combination supports joint internally, relaxes muscles externally. Red flags, stop and see a vet. Sudden worsening pain, loss of balance, dragging legs, refusing to eat, crying when touched. Take care of you and your pet.